Hello, my YouTube family. This is Dr. Lee, and I'm coming to you again with another one of my videos. This is with Pearson VUE, who's now been called Credentia. And this skill is performing modified passive range of motion for one knee and one ankle. It's a pretty simple skill. There's a couple of critical points that's in it that I'll really stress toward the end. And it's 7 steps, so we're going to go ahead on and get started with demonstrating this skill, and then we'll talk about it after I get through. Okay, so once again, this is with Pearson VUE, Credentia, performing modified passive range of motion for one knee and one ankle. All right, so let's get started. Hello, Miss Mary, how are you doing? My name is Dr. Lee, and I'm here today to do exercises to your leg. We call it passive range of motion for one leg. Okay, so I'm going to go ahead on and uncover one leg, and I'm standing on this side so that my YouTube family can see what we're doing. Okay? I close the door to the patient's room to provide for privacy, but I can also pull the curtain to provide for privacy. I'm going to support under the knee and at the ankle, not the foot, but the ankle, okay, and the knee. So, Miss Mary, I'm going to be raising your leg up and back down to the bed. We'll do that 3 times. If you have any pain or discomfort, please let me know, okay? And I also want to make sure that you are supine, that you're lying flat in bed as we do this particular exercise, which the patient is. So again, under the knee and under the ankle. And I'm going to bend and come straight down. How was that, Miss Mary? Was that uncomfortable? You good? Okay, we'll do it again. 2, and come back down. One more time, Miss Mary. 3, and come back down. You did an excellent job. Very good. Now, Miss Mary, I'm going to get ready to exercise your ankle. Okay? So I'm going to support under your ankle with one hand. Ankle, not the foot or the toes, the ankle. So under the ankle, and I'll take my other hand and I'm going to hold the foot. So we're going to go toward the head and back down three times. Miss Mary, if you have any pain or discomfort, please let me know, okay? 1, 2, 3. Great job, Miss Mary. Great job. Want to make sure that you have your call light where you can call me if you need anything. Go ahead on and open up your curtain. All right. Any pain or discomfort when I did the exercises? You're good? Great. I wash my hands and I'm through with that skill. Now, in real life, or if I was testing, I would exercise the leg on the side that I'm standing on. But I wanted you all to be able to see what I was doing. That's why I went to the other side of the bed. Okay? So, let's talk about this skill as we normally do for Pearson VUE or Prometrics. So, there are 7 steps in this skill. Number 1, explain the procedure, speaking clearly, slowly, maintaining face contact. We did that. Number 2, providing for privacy. We did that twice by closing the door to the patient's room and also with the curtain. Number 3, ensures that the client is supine in bed and instructs the client to inform the candidate if pain is experienced during exercise. So we did that before we started. Number 4 is in bold. So number 4 is a critical step that I must do. So number 4 says, while supporting the leg at the knee and ankle. So you must support at the knee and ankle. That's one part of it. Bends the knee, then return leg to client's normal position. Support knee and ankle. I'm going to bend it and bring it back to the normal position. So that means put it back on the bed. Don't leave my leg hanging up in the air. Okay, this is in bold, so I need to do this. Move joints gently, slowly, and smoothly through range of motion. and discontinuing exercise if client verbalized pain. This is very important because sometimes in the real world, when we're working with patients in the hospital or nursing home or clinics, the patient may have arthritis, bursitis that morning, and they are in pain. And when we come in to exercise, it may be very painful today for you to move my arm up and down. And if I tell you I'm hurting, we need to stop and go to the other arm or leg or do another exercise, but don't do the one that's causing me a lot of pain. Okay, that's what they're saying in number 4. All right, so let's look at number 5. Number 5 is also in bold. So I have 2 critical steps in this skill. Number 5 says, while supporting the foot and ankle close to the bed. Support the foot and ankle close to the bed. So in other words, I'm not going to bring it up in the air. Close to the bed. That's what that means, okay? While supporting foot and ankle close to the bed, pushes or pulls foot toward the head of the bed and back down. Toes point down. Toward the head of the bed and back down. Toward the head of the bed and back down. And we're going to do that 3 times, okay? Again, if the patient complains of any pain or discomfort, we stop, all right? Make sure the patient has the signal light. Bed is in a low position for the patient. And wash our hands and say we're through with that skill. So I hope this skill was very clear for you, providing range of motion for one knee and one ankle. Hope it was clear. If it was, please give us a like. Please subscribe. It helps us to keep videos coming on YouTube so that we can help you as you prepare to take your state exam or other students who may be in similar situations. All right. So with that, I will see you in the next video. You have a good day.